All right, team. So hip range of motion is important with everyday walking, and it's typically seen that we start to lose hip range of motion with osteoarthritis or hip degeneration. So individuals that notice they're starting to lose range of motion, it's important to start stretching these areas of the hip so that you can have a greater length of life with that hip without needing a total hip replacement. So there are three main stretches that I'm going to start with today that will allow you to start stretching the hip itself to start improving range of motion that will help improve the amount of motion you can walk through with normal daily activities. So let's get started. All this involves is being on your back, and you're going to have one knee up and the other leg is going to cross over the knee that's up, like so. So you're going to have your ankle or your foot on your leg that's bent, and then this one should be kind of angled in this figure 4 out to the side. From right here, this might be a challenge for some individuals. It might be hard just to get this to this position, so you might have to lower your leg to be a little bit more here. Once you're in this position, you can accentuate the stretch by pushing out like this. By pushing out, you're going to feel even more of a pull into the hip, or if it's a restricted capsule, you're going to feel it around the side of the hip or in the joint itself. The third way that you can start progressing that or changing the angle of pull is by grabbing this other leg and pulling towards your chest this way. Then you're really going to feel it in the muscle. But if you have hip osteoarthritis, you have hip degeneration, it may be hard to do that third variation, and you might be at this position alone. Okay? The second exercise that you can do to start improving hip range of motion is just a single knee to the chest. So this leg is going to go down. This knee is going to pull up to the chest like so. So in this position, you're going to come up and pull, 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 pull. You may only be able to get it to here. If you get to a point where you're thinking, I can't even grab my leg, I can't even pull it up because I have so much restricted hip range of motion, what you're going to want to do is grab a towel or a belt. You're going to put it around the leg through here, and that way you can hold the towel and pull the leg up with your towel. Okay? But for most individuals, they can grab the top of the knee and start pulling up to the chest in this angle as well. So those are two stretches that you can do for your hip overall to start improving range of motion. But a lot of times we have difficulty with hip range of motion in extension, meaning that the hip, as you walk, it needs to extend behind you like so, and it pulls the front of the thigh. And a lot of times with hip arthritis, hip degeneration, we can't get that full extension to the hip because of the amount of restriction from our degeneration or osteoarthritis. So one way that we can start improving this as well, I like to have a pad down so it doesn't hurt my knee on a hard surface. And you're going to be in this kneeling position, and you're going to take your body and try and make it fully straight like so. While you're fully straight, you're going to lightly lean in so that the body is going towards the foot that's on the ground. As you're coming in, that might be all the stretch that you need. You might only be able to get to here because it's so restricted and tight. But if you want to accentuate the stretch, you can continue to move forward, or what you can do is you can take your buttock and you can just tuck it under. By tucking it under, it's going to tighten down, or it's going to take up the slack through the pelvis, and it's going to elongate the quadricep on the front of the thigh, and what's going to occur is more pulling to the front part of the hip. So you could perform this safely and effectively by being in this kneeling position, staying vertical, and then lightly leaning forward alone. You don't have to tuck your buttock under. But if you already have pretty good range of motion, you might need to tuck in order to make that stretch more effective. So again, team, there's 3 exercises that you can start on. As soon as you start to notice that you're losing some range of motion to the hip, maybe you had an x-ray that says you have some mild degeneration, moderate degeneration. These are 3 exercises that you can start on to start assisting with hip mobility to try and ward off the inevitable total hip replacement. So these are things that we can do to start improving mobility, to assist with walking, assist with standing, assist with transfers from sit to stand. These are all areas that involve this hip and start becoming affected when we start losing range of motion through that degeneration process. So overall, I hope these are effective for you. If you like them, please hit the subscribe button and continue to get our videos. Also, thank you for watching and supporting what we do, and we will continue to put out more videos that affect daily function for yourself or possibly your friends. Again, team, thanks for watching, and keep moving forward.